Hello listeners, welcome to Views on Health. As yet another Monday evening comes by, I have with me tonight Dr. Indunil Piyadigama, consultant obstetrician and gynecologist, Base Hospital, Kahavatta. We had Dr. Piyadigama speak to us last time around on uterine prolapse. If you will recall, listeners, that was our topic. Tonight, it's infertility. Another problem that is, I would say, quite common in Sri Lanka, to the best of my knowledge. And as to how these things happen is, of course, something that we lay people have to look on the other side, ask the medical professionals how and why these things do happen. And when these things do happen, especially in our culture, in the Sri Lankan culture and in the family setup, it can be quite disconcerting because culturally, a woman is expected to bear a child. And if she doesn't, after a period of time, once she's married, a lot of concern. And even in this day and age, sad to say, such practices are there, such perceptions are there, and it can't be very comfortable for a young woman who's looking forward to having a child, but for some reason she's not conceiving. So having said that by way of an introduction, may I please ask you, Doctor, to please introduce this topic of infertility and update our listeners on this aspect.
Thank you very much for inviting me today. So basically, infertility, some people call it subfertility, is where a couple is unable to conceive despite having a regular sort of a sexual relationship. So this is sort of we would say it's a very concerning problem where you're expected to have a child within a certain period of time from the marriage and you're not having. So that makes a lot of psychological and a lot of social concerns, as well as you'll be really worried about it. But at the same time, if you really think about this in another way, when a couple gets married, it doesn't mean that over the next couple of months or within like few days that you will have a child. It's always a natural process where it takes time, and longer that you stay together, the longer your chance of conceiving a natural pregnancy. So what I mean by this is, if you really take the couples, if they are just married for maybe we say 6 months, you have a chance of roughly about 50% or half of the couples might get pregnant. But if you wait much longer, if you wait for about a year, on statistically, if we see, about 83% to 84% may have got pregnant by then. So only about 14-15% left without having children. But if you stay much longer, so till about 2 years, then almost 93-94% might have conceived naturally. So it's a process which happens over time where you have higher chance of conceiving little by little. But however said and done, now we say that after about 2 years, there'll be about 7% left without children. They are going to be in the end of the spectrum where need some sort of treatment. Otherwise, they would not be able to, because it doesn't increase over time. It doesn't exponentially, like it sort of flattens down from there onwards. So overall, this is what I would say infertility and how it affects with the time.
Do the genes play a part in this?
Yes, I think we can say that the genes play a part. But is it okay if I go into a little detail for somebody who is sort of has no idea about this? So how does a baby born, or how does a conception occurs? So basically you need to have an egg, and you need to have a sperm. And this egg and the sperm has to get together. So egg is produced inside the woman's body. So that is from the ovary that is situated inside the abdominal cavity, we call it. There's the ovary, and then it releases an egg monthly. Either ovary will release one egg from either side. Sperm is outside. So it has to be deposited into the vagina. And this sperm has to go up through the cervix, swim all the way up, and it has to meet the egg inside the fallopian tube. So what is the fallopian tube? That is the one that connects the womb, and that is the one which goes and catches the egg which is released into the abdominal cavity. So this egg comes through the fallopian tube. On the other side, the sperm will come, and they get together and form a two-cell mass, which is the earliest type of the embryo or the pregnancy. And this one, then, this, we can say it a tiny baby, will travel through the tube back into the womb, where it gets placed and where it gets implanted in and forms into a full-grown baby over time. So why I said this is the process. Anywhere in this process, if there's a disruption, then there'll be problems with conception or the pregnancy. So genes, of course, will have to have a role, because eggs will carry the genetic material. Sperm will have the genetic material. So those are the most important things. That is what is imprinted within them will make the child. 50% will come from the mother, 50% will come from the father. So in broad aspect, you're asking about what sort of problems or what are the causes of not having a child, or what are the causes of infertility. So if I go into that path, there can be problems with the male, there can be problems with the female, and there's always an unknown factor which is also there. And out of these, if somebody is asking which is more common, male, female, or the unknown, I wouldn't say it is one is greater than the other, but generally speaking, 40% or nearly 40% of the time it may be a female problem. Around 20 to 30% of the time it may be a male problem, and there are also maybe unknown issues for infertility as well.
Thank you, Doctor, for that very detailed explanation. Now, I assume this is common.
Yes, it's common. As I said, if you really wait for that given period of time, there'll be about 7%. But for us, a lot of people, like when they marry, within 3 months, they can't wait, so they come back to us. So it's a very common problem.
But then at that point in time, obviously to counsel them and make them realize that it has to be over a matter of time before they conceive.
Yes.
It may not happen just like that.
Yeah.
It can happen, it may not happen, either way.
Yes, because sometimes coming early, that we can counsel and send them back if there's nothing wrong. But sometimes there are problems that you detect at the first visit itself, that even if you wait for a long period of time, you wouldn't have conceived. So for those kind of couples, it's very important that you come early and get the treatment as soon as possible.
Which brings on my next question. So when they come, say after a couple of months of marriage, and they tell you that they want to have a baby but they're not conceiving, so just not that advising them that you may have to wait, etc., but would you also then conduct any tests to ascertain a likely cause?
So it's a very good question. So what happens is, when a couple comes, we take a detailed history to find out what sort of problems that they are having. So generally, if we are like in the initial bit mainly concerned about the woman, I would say. For the male aspect, at the onset, we are only thinking whether there's a possibility of depositing semen in the vagina so that it can swim up. But on the other hand, for the female side, we look for how the cycles are. So you all know that the natural or the normal female will have a cycle monthly. That is, you have a menstruation every month. So that means you are producing an egg every month. And during this period of menstruation, there can be slight pain, but not pain that will disrupt your work. And also, whenever a couple get together, they shouldn't be having any sort of pain during the intercourse. So those are the things that we try to elicit at the beginning to see whether the female is having any causes to have an infertility. If everything is within the set limits or normal, then what we would do is, as obstetricians and gynecologists, we would advise them to wait a bit longer, maybe 1 year or a little more than that, and then if they have not conceived by them, to try and come and visit us. But this is also, we make it a good opportunity to give certain advices. So generally, if a couple is planning to conceive, there are certain kind of prerequisites. So that is, if you're having a lower weight or you're within the healthy weight group, that is much more beneficial for you. So we advise on weight reduction, lifestyle changes, good food, and exercise. And we also advise to avoid unnecessary caffeine intake, smoking, alcohol, which can have effects on these gametes. The gametes in the sense is the sperm and the eggs, which are moving here and there. Then we also advise women to take folic acid 1 milligram daily if they are planning to conceive. Other than for that, we also make sure that they have the immunization that are necessary before going to a pregnancy. So one small thing is rubella vaccination. So we always advise them to have it so that you don't get rubella infection during the pregnancy, so that you wouldn't have any effects on the fetus or the developing baby on that. So those are the general advices that they will have during this period. Now the other thing is, a lot of couples are confused as to when they need to get together to have a baby. Because the cycle, there are different days and the chance of conceiving on different days are different. So what we advise is, if a couple is having regular cycle, if the female is having the regular cycles, then from 10th day till the 16th day, you have a very high chance of having a child. So those are the days that you have to get together if you're trying for a baby.
Doctor, if you take a young couple, you can tell them, advise them to wait, provided they have no medical issues. But say, now most people, especially women who are career-oriented, are putting off marriage till they achieve what they want to achieve professionally. And then they get married. So by which time they are into their late 30s, maybe going close upon 40. So it's getting more and more, sort of, I would think, far more removed from having, the correct age to have babies, so to speak. In such situation, they come and say, Doctor, I'm married now 1 year and I still haven't conceived. Would you still say wait?
Exactly. The question is very correct. I wouldn't say to wait, because why this question comes up is, woman from birth will carry her eggs. So basically, once a baby girl is conceived or within the mother's womb, she will develop the necessary amounts of eggs for her lifetime. So basically, what happens is, over time, now every month they will produce one egg and then get that goes off. You wait longer and longer, the quality of the eggs will go down because you're getting continuous exposure to the outside, and then the number of eggs are gradually reducing. So the good eggs go off. So basically, your quality of the eggs will go down as you get older. So if you're about 35, you do not have the same chances of having a natural, uncomplicated pregnancy like a woman who is in 25 or 20. So therefore, you don't advise them to wait much longer. If they are around 35 years of age, most of the time we try to start treatment as soon as possible.
But could there be other medical issues that also would prevent them from getting pregnant at a later stage?
Yes, that is also true. So, especially things like endocrine problems, we call it, diabetes, thyroid problems, then problems with the prolactin hormones, things like that can have a very adverse effect on pregnancy. Especially like if you take diabetes, sometimes couples may conceive and would not even know that they are conceived because the conception miscarries before it gets implanted because of the abnormalities in the body. Like this. So overall, if you take, you need to have a very fine environment for a conception to occur. If there are changes on this, there can be drastic effects.
In fact, doctor, that was interesting that you brought up diabetes because physicians and some other doctors, even like endocrinologists, have spoken of the issues pertaining to health, diabetes. So if you take a woman, and even if a man has diabetes, I mean a younger man who's now wanting to build his family, have a baby, so that condition in the system, the being a diabetic, can affect conception.
Yes, that can affect conception. Especially, it's for the female partner, but for males also there can be effects of diabetes for a conception, especially quality of the sperms and ability to keep the sperms at the right place will all be affected because diabetic men will have problems with erection and then also problems with ejaculation and things like that. So those are also contributory features.
So doctor, now infertility, how does one overcome this situation?
So as I said, generally good lifestyle is important. Then as you said, age is important. So if you're planning for a family, earlier the better. So those are the big two advices. Then if somebody is having problems, as I said on the screening, if there are issues that can lead to problems with infertility, it's important that you get assessed and have the treatment as soon as possible. So there are different ways of treating infertility, and these are all targeted at different steps on the initial explanation that I have given you. Having a good egg, having a sperm, and getting them together and putting them in the right place.
And so it's when that doesn't happen that the conception gets, it doesn't happen also, so therefore it takes time and it goes on like that. But at the end of it all, say nothing works, okay. Then what is the next step?
So, in a way, what is being asked is, now we try to find if there's a problem, okay? We try to find whether there's a problem in the male, whether there's a problem in the female. If we find the problem, then we can target it and treat it. Now, as I said, there's this group of conditions called unknown, or we don't really actually know what is the reason behind this infertility. Why does this happen? Because whatever the tests that we do are not able to pick up these subtle changes which can lead to this problem. So this sort of unexplained fertility is the one that you may be talking about, where we try a lot of things but still we are unable to have a baby. So for them, of course, there are different options. A lot of people like who have been treated for infertility might have heard about these things called intrauterine insemination, and also a condition or treatment option called IVF, or in vitro fertilization. So these are some of the ways that we treat infertility when we are finding it difficult to give the treatment the way it goes, when it doesn't success from the simple measures that we do. And even then, if there are problems in conceiving, it may be other options like we called surrogacy, or we can go for things like even adoption if there are problems of conception over time. Now, if we talk about a little bit more on certain causes for infertility, now some of the women may not have good eggs, or some of the men will not have good sperms to have a child. So previously, a few years ago, then fertility would have been a problem for these people. But nowadays, there are donor eggs and donor sperms. So that means, like, if you can't have a baby on your own genetic material, but still you can have a baby on your family where half of your genetic material is there. Either the wife will give the egg and an outside sperm, or else with the father's sperm with the outside egg, we can conceive it outside in a controlled environment and then put it back to the woman's womb to conceive. Then far more advanced ways where some women, due to different conditions, might not actually have a proper womb or have very defective or problems within the womb. So in that case, we can get the woman's egg and the father's or the man's semen, and then make the embryo outside and put it into somebody else, which we call the surrogacy, where we keep the embryo within the womb of another lady and grow the baby within it, and then later on, with their internal agreement, can give the child to this infertile couple. So these are also available options.
Doctor, are these options available in the government sector?
That is a problem, actually. Now, so actually we are having free healthcare in the system. So we do not have facilities at the moment for this IVF techniques, that is the in vitro fertilization. We do not have. But some of the government hospitals are able to offer IUI, that is intrauterine insemination, where you get the sperm and put it directly into the uterine cavity, where the egg and the sperm will meet up. So you make sure that they are much closer to each other to meet up. That is available in some of the government hospitals, but unfortunately IVF is still not available. There are a lot of ongoing process, and especially the subfertility specialists in the country are trying to negotiate and work on this. But however, it's a bit of an expensive process, and there are a lot of arguments for pro and against this, whether you can use the public funds for a fertility program or not. So those are controversial issues at the moment. But however, IUI is possible in some of the hospitals.
Thank you, Doctor. Time has caught up with us. Your take-home message.
So basically what I need to tell is subfertility or infertility is a common problem, but it's all about getting to know whether you have a problem or not, and what is your age and what is your expectation. And then having a proper discussion with the obstetrician and gynecologist to find out what are your chances of naturally conceiving. So if you have the ability to conceive naturally, then, and you have time and you don't have any problems, then you can wait a little longer, because your chances of conceiving increases over time. However, if you come to a point where you cannot conceive and you have certain problems, and they recommend you that you have you should be checked and you should have treatment, then that is the point where you go for the next options. All in all, for a conception to occur, there has to be a very balanced environment within the body in both the partners. So therefore, having good lifestyle measures, exercise, good diet, avoiding substance use are one of the key factors that you have to consider. Then the last thing is, women will have a cycle, and naturally in these cycles, eggs are released within the middle of the cycles. So within about 10 to 16 days of a cycle is the most fertile period. And if a couple is trying to conceive, this is the time that they need to be serious and think about trying to have a child.
Thank you. Good advice from Dr. Indunil Piyadigama, consultant obstetrician and gynecologist, Base Hospital, Kahavatta. And Doctor, thank you so much once again for being with us on the program. And we look forward to your presence in the foreseeable future.
Thank you very much.
And I hope our listeners would have take note of Dr. Piyadigama's advice, I would say, on what to do, what not to do, where infertility is concerned. Thank you so much once again, Doctor.
Thank you.
Thank you also to Nadira Manamperi for technical assistance. I'm Fatima Razi Khader saying good night and looking forward to your company next week, same time, on Views on Health.